So good morning, friends. Once again, we are back with our third lecture for today. And it's again a very, very interesting lecture. And I would like to introduce to you all my friend and of course, a networking partner, Jens Peter Wartmann. Jens is a partner at Proventis Partners at their Munich office. He is focusing on healthcare, particularly on small mid-cap pharmaceuticals, biotech, and medtech. I know JP for many years. He has been in a pharmaceutical industry. He has a long-standing track record in finance and general leadership in biotech financing and pharmaceutical sales and marketing. Without further ado, I would welcome JP to the Pharmacircuit platform today, conference today, and over to you for your talk.
Kuntal, thank you very much and for the kind introduction and good morning, everybody. I'm Jens Peter Wartmann talking here about a very hot topic in the field of digital health and all the challenges and the business environment, particularly for smaller companies, also with a particular focus here on Europe. Just to introduce myself and the company, Proventis Partners is a small cap, mid cap M&A and corporate finance advisory firm with 4 offices in the German-speaking region, so in Germany, Switzerland, and Austria. And I'm covering the healthcare sector after my tenure in the German biotech and generic industry. But now with my biotech financing expertise, I'm also focusing on digital health. And this is a sector which is particularly hot at the moment, but young companies are facing some particular challenges, as well as do investors in the space, as this is really at the frontier of science and technological development on the one hand, but also on the investor side, as well as on the company side, there are many, many deep tech IT companies pouring into the healthcare space and do not have the track record, the expertise, and sometimes not the knowledge about the particular requirements in the healthcare space, especially in the light of reimbursement, because as you as healthcare experts probably know that the reimbursement question is a very crucial one in the sector. And with that as an introduction, I would first like to share some light on the environment to give you just a flavor on the size of the market and what happened in this space. So first of all, there is a heavy startup founding seen in the last few years. Naturally, of course, the US from the Western or European and US perspective, the US is therefore the biggest market naturally, but also in Europe and also in the DACH region and Germany, there are a number of startups being founded. Overall, the funding volume is tremendous, has been growing with over 35% compound aggregate growth rate over the last 5 years. But as you can see, the very, very peculiar year of 2020 has seen a significant rise in the funding, with an increase by 63% to globally around or nearly $40 billion. And that also in light of course, the COVID crisis. So it is really a very particular and compelling increase in the funding. When we look at mean and median funding volumes for the individual companies, we see, of course, that The US typically has the highest numbers, but compared to previous decades, I think the European companies and the European and markets are really catching up. And we have seen a number of big ticket funding in the last year with companies like Cry from Sweden in the field of telemedicine, in particular, Compassion, a UK company focusing more on medtech devices and everyday wearables, from watches to also other healthcare or simply household things or other things of the daily life, which can be attached to the mobile phone and be used for personal health tracking. I'm sorry, the things from France and Compassion and Atai are mental health and digital health companies focusing in particular on mental health diseases and conditions which can be treated with traditional medication, but also, of course, with new digital means, telehealth interactions, which could make interactions with a patient much more convenient and often more frequent than traditional visits to the doctor. But of course, digital health and the digital health tech space is a very crowded space. It is, of course, impacted by different definitions. We tried to give you here a flavor also with some numbers in which of the subsectors most of the funds flew. And we see that, of course, the largest space is the telemedicine space, which also I personally believe will be an area where we will see much more innovation and also facilitation of services plus reimbursement, particularly spoiled by the COVID environment, because we know that we all need to keep social distance and interaction now with healthcare professionals by using or with the help of using wearables and real-time monitoring devices is a great field where we'll see much more innovation and new processes, new products coming in over the next few years. This is, of course, linked to mobile health, which is includes any kind of wearables, whereby here, of course, you have to differentiate the number here also includes a number of wearables for personal well-being, fitness, and not strictly healthcare focus, but really personal well-being devices. And then the third big field is, of course, the field of big data analytics, longitudinal studies, much more analytics with respect to health outcomes and clinical trials. And then we have a number of other sectors, which includes clinical decision support to physicians with the help of big data analytics and algorithms in various subsectors, then anything which can improve really the flow and the efficiency of healthcare systems, particularly in the hospital sector or in the entire reimbursement and billing and financial um, management of the huge funds which are flown around the sector from the payers to the pharmaceutical industry, doctors, hospitals, and all the other professionals working in this space. Individual wellness is another sector or subsector of big interest for investors, as this is particularly not impacted by reimbursement, but this is direct payment by the user. And last but not least, also healthcare booking as a online service, simply that you can book a doctor's appointment. Like travel is another field in which significant monies flow. I would now particularly go into more detail of the challenges that young and small companies face in this field, as I started off with the three challenges. Small companies with limited resources, great ideas, limited experience in the field, investor hype, where there are significant monies flowing into the sector, but nonetheless, there are some investors who are coming from the deep tech and IT and software space who are not so knowledgeable about the specific requirements in the healthcare sector. And last but not least, the crucial question when we go to the core healthcare sector of reimbursement, how to get public healthcare funds and healthcare insurance systems to pay for the service or the use of device. With that, I would start with the first company we have been advising in the recent past. This was a digital imaging software company which provided software solutions, particularly for X-ray diagnostics and interventional radiology, trying to improve clear unmet needs with respect to better image quality for better and earlier diagnosis on the one hand, and of course, the overall goal of X-ray radiation reduction. We advised the company with funding and the quest for a strategic partnership. The challenges were that it was also a typical startup situation, small team, little money, great concepts. In this case, it was really a science-heavy management with a certain shortcomings in commercialization expertise. Of course, the huge X-ray market is dominated by the large OEMs, and with a limited amount of funds, the company did not have really a huge amount of clinical data. After starting the approach to strategic as well as financial investors, the skepticism rose about the market success. In particular, it was questioned whether an independent commercialization was possible, or whether this was only a feature which could be commercialized as an add-on or as a particular feature to a large CT system by the big OEMs like Philips, Siemens, GE, and the likes. And within those large organizations, we were confronted with a not invented here syndrome. Also, when diving deeper, people asked, okay, this is compared to the entire X-ray dosing and an X-ray intervention, how would even with clinical data reimbursement be granted? Can the impact be clearly differentiated, and what would payers be willing to pay. And last but not least, one surprising feedback from a large hospital customer was, the X-ray radiation is something which we really would like to see, because we would have some reservations with respect to labor law issues, since doctors in interventional radiology have to face, so to say, this was a saying, a certain risk, and they would not invest in a tool which really puts this on the forefront. So these were all feedback and reactions from the market that ultimately it was not able to go for private funding in this impact. But luckily, the company secured public sector money from the EU for further product development and particular data generation. And with more clinical data, of course, we hope that some of the skepticism can be overtuned, and in particular, talks with large OEMs can be revitalized. The next company is also a very, very hot sector, the logistics sector, with a particular focus on cool chain logistics for pharma and medtech products, which is getting some very high attention in the light of the coronavirus vaccine situation, particularly BioNTech Pfizer with minus 70 degrees Celsius requirements. But the focus in the global supply chains for biopharmaceutical products on a regular basis, requiring cool chain logistics, is something where a lot of interest is growing. Also, typically the entire logistics sector is something which is, driven by physical delivery, physical services, with a very, very low digitization rate so far. And therefore, a lot of so-called Logitech companies are getting a lot of funding and interest by investors who really see significant value generation chances by digitizing this sector. Although, of course, we must not forget that logistics, in particular when we talk about pharma and medtech products, for the foreseeable future will be linked to physical delivery, and cool chain logistics require measurement and documentation of temperature, of humidity, and maybe even other features relevant, particularly for precious and sensitive pharmaceutical or medtech products. So this company is developing an end-to-end cool chain logistics solution with hardware embedding or hardware embedded sophisticated sensors and cloud-based real-time monitoring and tracking solutions, particularly relevant with respect to automated GDP documentation. The advantage here is, I think, a very deep understanding of the physics of temperature and humidity measurement, and this building into different hardware devices and combining this with IoT and cloud-based monitoring and tracking solutions. We advise a company with respect to a Series A funding. Again, smaller startup company, as indicated before, crowded space, and with respect to business development activities of the company with regard to large pharmaceutical or medtech companies and large logistics companies, that some of the hardware products are still in development or in the validation phase. Market feedback uh, circled around skepticism about the competitive edge and the USP of the company, also tapping on direct funding from statutory health systems was not possible. Of course, it is not regarded as a core activity, although necessary for a number of healthcare products and pharmaceutical products that the healthcare systems do not have any formal means to support such activities. On the investor side, many of the tech-driven investors do not understand pharma needs, GDP regulation, think that this pharma GDP environment is rather cumbersome and bureaucratic. And last but not least, some of the tech investors who want digitization solutions simply don't like hardware, and some even try to convince the management to skip the hardware component, whereby the integration of hardware and software for the pharmaceutical industry is a core asset. Nevertheless, throughout this funding exercise, we learned that we should turn away from the typical VCs and rather build a consortium around strategic pharma investors and specialized logistic investors, more family office, private investor type vehicles than typical VCs, who both have a clear understanding of either the pharmaceutical needs and GDP requirements, as well as a command of the entire value generation chain in the logistics sector. And with that, we are very confident to close the Series A funding very soon. The third company is a therapeutic gaming company from Germany. Here I can name the company. It's Retrobrain from Hamburg. They are developing unique therapeutic gaming solutions in the field of elderly care and later on therapeutic gaming devices and therapeutics in CNS, in the CNS field, with a particular focus on Parkinson. We support the company with funding and strategic partnering. The challenges of this company were also the typical startup situation. It had a certain somewhat complex funding history in the past. They have meanwhile very compelling real-world evidence in the field of elderly care, but only limited data in the CNS field with respect to hard data in the Parkinson field, for instance. It is a complex business model. It's also not an app, so it has a hardware device especially designed for the use by elderly people with cognitive impairments, etc. So we were facing similar challenges, that VCs don't like complex cap tables, that there is skepticism about scaling and reimbursement beyond project-based funding for elderly care homes. So the company has actually achieved reimbursement in elderly care and nursing homes, but not yet in the ambulatory field. Of course, elderly care is not always regarded as to be the sexiest field you could be in, and the more heavy and straightforward pharma medtech investors require more clinical data in the CNS field. So this is again a chicken egg problem, how to get funding for clinical data development, and investors want to see traction in the field and or better data. So we then also shifted the focus more on strategic partnering in the elderly care nursing home market, where the company has actually received this first level reimbursement, and some of the players in the German statutory health insurance market will back the company from a strategic perspective, so that they will get more traction in the elderly care market fairly soon. And meanwhile, further deep dive analysis of a recent real-life study revealed really convincing and with a high confidence interval data that playing patients or elderly people really improve their cognition compared to non-participating people. And with this data, we will also approach pharma and medtech investors very soon. And last but not least, a very interesting company is Magic Horizons from the greater Munich area in Germany, who is developing mental health and relaxation solutions with sophisticated VR solutions. The company is founded by two brothers who are coming from the entertainment industry. They develop a holistic concept for mental relaxation with truly immersive 3D experiences accompanied by binaural beats. It is here a seat situation. In this case, it's a very small team, but they have many options available and more leads and verticals to be grasped and followed, which the small team cannot yet do in a structured way. For some of the VCs, it is too early. Also, skepticism of scaling is always a question, and there is uncertainty and ambiguity about a very complex business model simply due to the various routes open. So is the company going for a medtech product with the regulatory requirements and the question of reimbursement? Is it possible? Same applies to the B2B product of employee well-being. Question here, could employee well-being solutions also be reimbursement, or is it better to go for B2B to C or generally X2C consumer-based model in global markets, where you then would not have to fight for reimbursement by public sectors. Here, the solution was to refocus the funding plan, go for the lower hanging fruits, and focus on immediate commercialization options, which means that the reimbursement route and regulatory route for a medtech product was skipped for the moment. The company has secured a first closing with high caliber business angels in the field. This will happen in April, maybe followed by a second closing in May. With that, I thank you very much for your attention. In case of any questions, please let me know. Thank you.
Thank you, JP. It's a real pleasure to have you today. I think, in all the skepticism in the world of, uncertainty we are living today, I think you gave us a little ray of hope. I think this positivity really will take us through, for next 6 months, next few months. I have only one question due to paucity of time. In terms of telemedicine, where do you see Germany currently standing? Because in US it's a big thing. You mentioned telemedicine as a big thing, so is it still in Germany a big thing, or it will be bigger in near future?
Well, we have a very lively startup scene in this field, in particular in the Berlin area. There are many telemedicines startups and ideas coming up. Also, young companies with the integration of software engineers, data scientists, and doctors. I think with the so-called DIGA concepts, also the German regulatory environment is at least compared to German standards, it's fast moving. So I believe that, and the hope is that there will be much more traction be made. On the other hand, when you look at, I mean, in the light of COVID, what we heard here in other presentations over the last 2 days, whether
Yeah.
it's digitization and the vaccination exercise. Let's fingers crossed that the people in Berlin hear the bell and that they know that they have to be more proactive in this field.
Yeah. Okay. No, thank you, JP, for your time today. So, really appreciate your thoughts. So, we will be now, going for a networking break. And as I said, ladies and gentlemen, you have option to go for a blind date in networking. Automatic it comes when you join with audio or video. But if you want to be a little bit professional, you can go to the event page in networking session. You can actually schedule your meetings, you can see who are there, and you can do it in a more professional way. So I leave it up to you. We'll be back at 12 with boosting innovation, digitalization, and AI and digital twins by Oliver. So another interesting topic after JP's. So thank you, JP, once again, and we look forward to keeping in touch. And anybody who wish to contact JP, please contact us, or he will be also sharing the presentation with his details coordinates.
Thank you,
Thank you.
Günther. Bye bye.
Have a nice day. Bye bye.